My name is Jessica, and a day in the life on an adolescent unit includes in the morning, a lot of the patients have programming, so I'll kind of assist them in going to their programming. Oftentimes too, they may have distress throughout the day, especially if they've had a hard day in treatment, so I may help them with their distress. And then in the evenings, a lot of the patients have outings, so oftentimes we go on the outings with the patients and we assist them in working on exposures on the outings, or even just having a fun time with them and encouraging them to participate. We tend to use technology in multiple ways. I know for one big example of using technology is charting. So charting involves writing down and documenting anything that the patients are doing that are related to the treatment. So could it be any behavioral observations that we observe as staff? And we're writing it down not only for insurance to know about it, but also for the treatment team to know about it, to know what steps they need to take in the patient's treatment. Another way that we may use technology is for rounding. So we have these iPads, and we take these iPads around the unit with us, even on outings sometimes, to make sure that they're maintaining safety and that we're checking in with them to see if they need anything.
Hey, just checking in. You doing okay?
So some of the medical aspects are administering medications to the patients. Each of the patients have medications that they take in the morning, and they also take them at night. So it's our job to kind of give them their medications within the time frame during those morning and evening times. Additionally, another medical aspect that we do is taking vitals and taking weight. So especially for our patients with eating disorders, that'll be something that we'll have to do, and it's really important to make sure that they're getting proper nutrition and maintaining weight and or gaining weight.
Okay, well, your vitals look pretty good, 145 over 92.
Additionally, there may be cases where we'll have to provide first aid, especially for cases that are self-harm. Safety is one of the most important aspects of this job, and every so often we may have a patient who may self-harm so severely that they're going to need a trip to the ER. I can't say that it happens too frequently, but I would say that it happens enough where I've had to make a couple trips throughout my year working here. There are many physical parts of the job. One of the biggest physical parts is a lot of walking, especially when we're rounding. We're walking around the unit, checking with the patients, and that can involve a lot of sitting down, standing back up, walking around, going on walks, with the unit, checking in with the patients. And I will say that I often have to wear comfortable shoes because I'm going to be walking outside on trails with the patients, or I'm going to be walking around the unit and I don't want my feet to hurt. There are many challenges. Every patient's going to be different, and every patient's going to have different levels of distress. So being able to kind of gauge what the patient's safety is and what steps need to be taken in order to ensure patient safety is one of the hardest aspects of this job. But I would say that you're never alone in anything that you do. There will always be another staff member with you to help you if there's any problems that arise. So if you ever are feeling alone, make sure to always ask somebody for help. I would say that the rewards far outweigh the challenges that occur. It's really amazing to see a patient come in who may not be themselves, may not engage with their peers, and when they leave after treatment for 2-3 months that they're here, they leave an entirely different person who's happier, healthier, and more confident in themselves. And seeing that transformation from one person to a different person is something that makes this job entirely rewarding.